This week, we will be in Geneva, Switzerland for the 78th World Health Assembly, otherwise known as the WHA 78. The WHA is important because it is attended by delegations from all the 194 member states of the World Health Organization. And Kenya is one of the WHO member states, and we will be there. The WHA is the highest decision-making body of WHO and convenes every year in May, and its main function is to determine and approve the global health policies, and these global health policies are what are translated into regional health policies for the continent, and then ultimately into national health policies and strategies and guidelines on various health topics. These topics that will be discussed in this year's WHA include non-communicable diseases and mental health, universal health coverage, human resources for health, reproductive, maternal, newborn, child, and adolescent health, antimicrobial resistance, disease outbreak prevention, preparedness, response and resilience, the impact of chemicals, pollution, and climate change on health, neglected tropical diseases and other emerging infectious diseases, and many others. Every year, the World Health Assembly has a theme whose aim is to galvanize all governments and global leaders to consolidate their support and resources towards the most pressing health needs. And the theme for this year's WHA is One World for Health. In line with this theme, Kenya will be making a very bold national statement at the WHO on primary health care being the most effective and equitable path to UHC. We will be showcasing Kenya's incredible contribution towards meeting the global SDG targets on UHC under the Kenya Kwanza government and under His Excellency William Samoei Ruto through establishing the primary healthcare networks and deploying 831 community health promoters, equipping them and empowering them to make sure that health services reach the common mwananchi at the grassroots level in the community. When we come back home from the WHO, we will reinvigorate our efforts to ensure that all citizens have equitable access to quality and affordable healthcare at international standards, and by implementing the priorities, solutions, lessons learned, and best practices by benchmarking with other countries that will be attending the WHA. As part of our commitment to update you on all our work advancing health for all in Kenya, make sure that you follow us at the Ministry of Health on all the social media platforms for the latest information and the news on the WHA throughout the week, straight from Geneva, Switzerland. My name is Mary Mudhoni. I am the Principal Secretary for Public Health and Professional Standards in the Ministry of Health, Kenya.